Good morning, good afternoon, and good evening, everybody. Welcome to today's webinar for the global launch of a roadmap for advancing sanitation regulation. My name is Dave Truba. I'm with the WHO WASH team, and I will be your facilitator today. The roadmap was prepared by WHO in collaboration with the Water and Sanitation for Urban Populations, Eastern and Southern Africa Water and Sanitation Regulators Association, or ESAWAS, and UNICEF. As noted in the last global report of the Global Analysis and Assessment of Sanitation and Drinking Water, or GLASS, countries with well-resourced and functional regulatory systems are significantly more likely to be making progress toward their national sanitation and drinking water targets. So with the deadline for the SDGs less than 5 years away, the arrival of the roadmap is very timely. So just a little bit of quick housekeeping before we get going. Number one, please keep muted. You won't actually be able to open your microphone during the question and answer, but you will be able to use the chat for comments and questions. You can also now introduce yourself in the chat if you would like. We have more than 400 people registered for today's webinar. Do ask for technical assistance in the chat, and we are recording the session. Our session today is only in English, but we will endeavor to make both French and Spanish language versions of the webinar recording video later, as well as transcripts, and we will of course share the slides. On the screen before you, you also see the QR code and the link to the roadmap in case you would like to download it and look at it while we're going through the program today. So I'll run through the agenda quickly. I'll make the individual introductions during each session for the many distinguished experts we have with us today. So for now, I'll just mention that we'll have opening remarks from representatives of the organizations behind the roadmap. Then we'll give you a very quick 10-minute overview of the roadmap from Sam Drabble, who has been instrumental in preparing it. We also have country spotlights, very exciting presentations from Peter Mutali in Zambia, Maud Rosalimin Mahidin in Malaysia, and Rodrigo Farias in Chile. Then we'll have a panel discussion with live questions and answers, and we'll have some closing comments. So with that, we can now move on to the opening remarks with representatives from the four organizations behind the roadmap. First up is Bruce Gordon. Bruce is the head of the Water, Sanitation, Hygiene, and Health Unit at WHO and also vice chair of UN Water. He leads global efforts on WASH guidelines, monitoring, and policy and has over 20 years of experience advancing public health through safe water, sanitation, and hygiene systems. Bruce, welcome to the webinar. Over to you.
Well, thank you so much, Dave, and thanks to all of you who have come to join and my colleagues online. I think our first line of defense when it comes to public health is professional oversight. A good quality of service depends on that. And when we think of public health, we think of safety, of course, but we also need to think about confidence and public trust. And all that comes with arrangement and good capacities. And of course, we know that, as you mentioned, there's importance in regulation, but there's also a great opportunity, especially with sanitation regulation, to make public health gains. We know from, again, I think, Dave, you mentioned the GLASS data, but to give you a little bit more insights into what's publicly available. And of course, when we look at drinking water, there's credible amounts of public information that is published through regulators. But when it comes to on-site sanitation, where some of the most vulnerable live and depend on pit latrines and septic tanks, there's very few regulators. There are very few publicly available information, which is indicative of an opportunity to extend regulation and to make that data more public and improve public data management information systems so we could target interventions. So that's the need. Of course, sanitation is the root cause of most waterborne disease, the vast majority of it. So I think I mentioned drinking water a few times, but I think that's where we want to head. We want to head. Many of the regulators here are also regulating drinking water. And we know that a few countries in the world have been doing this for more than 100 years. So we want maturity there, and to get us to that place where we can together build regulation for sanitation, for very difficult aspects of sanitation, I might add, where you need things like sanitary inspections or sanitation safety plans and surveillance. I mentioned data management systems. I think it can be confusing. So this idea of having a roadmap that we've developed collaboratively that's kind of step-by-step, flexible, simple, and that can be done in resource-constrained in countries and areas. I think that that's very key. So I'm really keen to hear how this can be implemented and to hear the insights of my colleagues. And again, welcome to this webinar. And back to you, Dave.
Thank you so very much, Bruce, for those insights. And this is the beginning of the journey on the roadmap. We would now like to welcome Kitka Goyol, who is the Regional Advisor for WASH and Climate and Environment at UNICEF's Eastern and Southern Africa Regional Office, or ESARO, based in Nairobi. With a deep expertise in water supply innovation, such as the More Water, More Life initiative that doubled drilling success and improved access for over 1.2 million people, Kitka drives region-wide efforts to strengthen WASH systems, particularly in Arab and climate-vulnerable contexts. Kitka, welcome to our webinar. We look forward to hearing from you.
Thank you, Dave, and good morning, good afternoon, and good evening for all our participants. And I really want to thank WHO and all the counterparts mentioned for the great efforts that have been put into developing this roadmap. As we heard from Bruce, the need for regulating sanitation is more than required now, because we know that we are working towards the attainment of safely managed sanitation services by 2030. Now, so many aspects of sanitation is going on, and if we don't regulate each of those, the chances of harming the physical environment, the chances of really making people vulnerable, exposing them to risks of public health emergencies then becomes high. We know of all the global efforts that are going on to ensure that everyone, everywhere has access to safe sanitation, but we need to regulate these services. I want to really recognize the efforts of ESAWAS, which is the regional body in the Eastern and Southern Africa region, for championing this in the sub-region, because without this, I think the services that we provide would not deliver the results that we want to see. I want to say that we need this regulation also because what we call the last mile is now living with us in terms of the rapid urbanization that is happening. And we see that the underserved areas of the urban settlements, the exposure there is a lot higher than what it is in our far rural areas. As we were told by Bruce as well, this guideline or this roadmap is supposed to help us take incremental steps towards that level of service that we want to achieve. So I want to really encourage us all as we participate in this webinar, as we get exposure to this roadmap, to see how best we can apply it in our different contexts to make sure that we incrementally move along the ladder and get to that gold standard of making sure that sanitation services are well regulated and they deliver the services that we all need. So with this, I'll hand you back to David and wish everyone a good webinar. Thank you.
Thanks very much, Kitka, for those inspiring words. And also, please extend our thanks to your colleague, Arnold Cole, for the wonderful work that he has done on the roadmap as well. So moving on, we now have the pleasure to welcome Yvonne Magawa, who is the Executive Secretary of ESAWAS. Again, that's the Eastern and Southern Africa Water and Sanitation Regulators Association. Yvonne has 2 decades of regulatory experience, and she plays a leading role in strengthening WASH regulation across Africa and serves on several advisory boards and the IWA Strategic Council. If you go to the ESAWAS website, you'll see just an incredible flurry of activity by ESAWAS on regulation in the region. Yvonne, welcome. We look forward to hearing from you.
Thank you very much, Dave, and thank you to Kitka and Bruce for providing the firm context for why the roadmap has been developed. So good day to everyone, and it's great to have your support in the launch of this roadmap. So really, ESAWAS is a firm believer in the saying, if you want to go far, go together. So this global launch of the roadmap for advancing sanitation regulation demonstrates how synergies and partnerships can collate knowledge for wider replication across countries. It is a distinct honor for ESAWAS to have been part of this work and share the experiences of our members, as Kitka has alluded to. Regulation has emerged as a key driver, a catalyst, and enabler to accelerating improvements in service delivery. So the water supply and sanitation regulators from East and Southern Africa are playing a leading role in organizing the sanitation sector for professional, affordable, and sustainable services. ESAWAS, in collaboration with partners, has been instrumental in supporting these countries to implement inclusive sanitation regulation. This support came with the realization that national roadmaps were needed for countries to have guidance on the requirements for progress. Therefore, the roadmap being launched today is of particular significance to us in designing targeted interventions for where countries are. So strengthening regulation provides a key anchor to realizing government and sector aspirations for universal access to quality and affordable services that impact health and economic growth. We are and commit to using this roadmap and ensuring that we're able to support countries in its usage so that we make use of the publication to really support countries to attain meaningful progress in sanitation service provision, which is already being done by some of the countries in East and Southern Africa. So we want to ensure that we can achieve this through effective regulation. Thank you.
Thank you so much, Yvonne. Very inspiring words as well, and we look forward to hearing from you again later on in our live discussion. But last and not least, we would like to welcome Sam Drabble. Sam is Director of Research and Evaluation at Water and Sanitation for Urban Populations, known by everybody as WSUP. He leads the research and learning across 6 countries in Africa and Asia, and he has authored over 60 technical publications and recently led global studies on wash system strengthening, including this roadmap, which we're about to hear a little bit more from him about. But before that, just a few words of welcome from you, Sam, would be very much appreciated by everybody on the call today. Over to you.
Great, thank you, Dave. Really a pleasure to be on the call. So a few words on WSUP's perspective. The first thing to say there is our perspective on regulation is derived directly from experience in our focus countries. So WSUP has 6 country programs in Africa and Asia. We've worked closely over a long period of time with regulatory authorities in many of those countries, for example, in Kenya, Zambia, Mozambique, and we've really seen firsthand in those countries the tremendous impact that regulators are having in, for example, driving processes of sector reform, coordinating stakeholders, innovating to achieve equity, leading the response to new challenges like climate change. And that's not only happening in Eastern and Southern Africa. There are examples that we'll hear from in Latin America, in South Asia and Southeast Asia. So we firmly believe that regulation is a pivotal part of system strengthening activities at country level, and that conviction is born from program experience. And then the only other point I'd add is that WSUP works at the interface of research and practice. So through our research, we're aiming to share learnings from our programs, from partnerships with ESAWAS and WHO and UNICEF and others, and the wider evidence base, and really aiming to amplify that experience to influence adoption of best practice in the wider sector. So this roadmap, we're tremendously excited by this document because it's a really pure expression of that aim. We believe very strongly in the guidance, and we're committed to supporting application of these principles as well, and continuing to build the evidence base. And regulation is a core part of our next 5-year strategic plan because of those convictions. That's all for me to begin with. Dave, back to you.
Thanks very much, Sam, for those excellent comments, and would encourage everybody to visit the WSUP website and look at that new strategic plan, which Sam referenced. It's a really excellent document. So thanks very much to Bruce, Kitka, Yvonne, and Sam for their opening remarks. Sam, we're going to put you on the spot again because you've been working so intimately with the roadmap over the last couple of years. You are the prime person to give our nearly 200 webinar participants a quick overview. So turn it over to you once again.
Okay, so yeah, I'm going to speak for around 10 minutes or so. First thing I'll say is I will be covering quite a lot of ground, but as Dave mentioned, the slides will be shared. So a pleasure to have this opportunity to introduce the roadmap. Next slide, please. So beginning with some background on the approach and methods for this document. So the roadmap aims to support countries to advance from little or no sanitation regulation towards functional regulatory systems. 2 points to emphasize up front. First is that the roadmap is truly global in scope. So it's drawing on experience from across Africa, Asia, Europe, Latin America. Secondly, the guidance is very firmly grounded in the perspectives of regulatory authorities. So the key data collection here was in-depth consultation with those regulators across regions. And my role in this process really was to synthesize the perspectives of those regulators to develop principles for wider application. Next slide, please. So here you see the full roadmap, and we're going to move into each of those steps in turn. What I want to say just at the start in terms of interpreting the roadmap is that it's not necessarily conceived that these steps would be implemented in their totality or in this order. You know, some of these areas might be implemented in parallel, in a different order, or not at all, depending on the country's starting point. So the roadmap is very clear on that contextual importance of interpreting this guidance. Next. So we're moving into those areas. Area 1, establish the current legal basis for sanitation regulation. And you're going to hear from Peter Matale shortly in Owasco, who's incredibly clear on the power of a legal review as a really tangible first step that countries can take at an earlier stage in their journey to begin to move forward sanitation regulation. And that needs to clarify who is responsible for which aspects of sanitation services, including policy formulation, regulation, service provision, revealing any gaps or overlaps in mandates. And also a contextual analysis needs to accompany that to inform any potential revisions to the institutional and regulatory framework. Next. And for each of these areas, we set out guiding principles in the roadmap document and also illustrative case studies. And here Zambia is the case study that we showcase, this legal review that led then to a new institutional and regulatory framework for on-site sanitation and fecal sludge management. And certainly reviews of this type will not always by any means lead to wider reviews to the institutional and regulatory framework, but that needs to be considered. Next. Now this second area, yeah, thank you. This second area provides guidance on reviews of the institutional and regulatory framework where those are perceived to be helpful. And it showcases really the importance of connectivity between regulation and service provision and responsibilities at the ministry level. So there needs to be clarity of regulatory responsibilities, of course, across the different functions: economic, environmental, public health, clarity of service provision mandates, clarity of ministry roles, and recognition of the interconnections between ministries, regulators, service providers. Unless clarity is there across these areas, then regulators will find difficulty in performing their function effectively. Next. And here you see guiding principles that build from that. And what I want to highlight is a really important question around the creation of autonomous regulatory entities. So we are clear in the roadmap that, of course, there are a wide range of regulatory models that exist. We recommend that autonomous regulatory entities should be considered with technical, managerial, financial independence from the responsible line ministry. But regardless of the model, the key point is that the regulatory office or entity should have decision-making autonomy insulation from political interference. It's also notable when you look across regions, the number of countries that are engaged right now in reviewing the institutional and regulatory framework for sanitation in different ways. And we give examples of Mali in West Africa, Nepal in South Asia, who are an example of a phased approach towards introducing an autonomous regulatory entity, beginning first with a ministry-level regulatory and monitoring unit, and Peru in Latin America, where the regulator's scope is now expanding to include small towns and rural areas. Next. Area 3 is the most detailed in the roadmap, and this is speaking to the range of regulatory tools that regulators need to have at their disposal. So it covers, of course, developing regulations, guidelines, standards, codes of practice, establishing a methodology for setting tariffs for economic regulation, licensing regimes, compliance monitoring and enforcement, the regulator's role in raising customer awareness, and facilitating performance benchmarking, public performance benchmarking ideally, against key performance indicators. Next. Again, there is wide-ranging guidance in this area. I would highlight support around the formalization of sanitation workers, which is referenced relating to regulatory frameworks, supporting or setting tariffs that can incentivize efficiency, equity, high performance, and enforcement is a particularly challenging area. And here the guidance is around a responsive regulation approach, so promoting normative motives for compliance, creating positive incentives for compliance. Regulators, of course, need to have recourse to hard sanctions, but those really should be a last resort. The emphasis should be around positive incentives. And comparative data on service provider performance and publishing that wherever possible is one such incentive. And we highlight WSUP in Kenya introduced a Propol key performance indicator, which has led to improved services in low-income urban areas. Manila in the Philippines, an example of leveraging the tariff instrument to incentivize performance, and sanitary inspections, and the example of Ireland, where a national plan has been implemented very effectively for inspection of domestic wastewater treatment systems in rural areas. Next. Area 4 then is around data management. So this is looking at the regulator's role in establishing robust public data management systems. And this includes establishing consensus on key metrics, conducting sanitation service baselines. Many countries in Eastern and Southern Africa, for example, engaged in that currently, and developing local level and centralized data management systems. Next. Now on the guidance here, I'll just reference the importance of connecting local level, national indicator definitions and monitoring elements with also regional and global monitoring frameworks, but with the emphasis that there needs to be flexibility to build in local level indicators wherever those are required to respond to contextual requirements. And we give examples from Palestine, a really large scale mapping supported by UNICEF of over 400 small scale on-site sanitation systems in peri-urban and rural areas, and led by the regulator WSRC, and at the state level in India. Next. Now, Area 5, we're moving towards what might be framed as higher capacity, more active regulating. And this is an important distinction that we set out in the roadmap. Historically, in the sanitation sector, there has been what might be framed as the passive development of regulations, but not then active regulating to ensure that those are operationalized effectively. And this is speaking to the leadership role also that regulators can play and are playing in sector coordination, in building the capacity of service providers that they regulate, and also engaging in really complex questions around financing, for example, helping to introduce new revenue streams like sanitation surcharges. Next. So here you see the guidance around this potential leadership role. Of course, to deliver that, regulators need to become trusted technical and social actors, and that trust can't be taken for granted. It has to be earned by the regulator, but there are many cases where that is happening. We give examples in this area from Rwanda, the regulator's role in strengthening service provider capacity, and also Mozambique, where the regulator has helped to introduce a new sanitation tariff. Next. And finally, Area 6, and this is really to underscore that this roadmap has no fixed endpoint. There is only continual adaptation and iteration of the regulatory approach. And we here highlight examples of mature sectors with high levels of service coverage, but with proactive regulators who are already now looking ahead. What are the challenges that they need to be engaging with, the challenges of the future as well as the present? And the particular focus there is on climate change. If we go on to the next slide. So we provide principles here around how climate resilience can be mainstreamed into guidelines, standards, codes of practice, how to adapt tariff models to support the costs of climate resilient sanitation, how to support service providers in adapting to droughts and extreme weather events. And you'll hear from SPAN in Malaysia, SISS in Chile shortly, two really strong examples of proactive, forward-thinking strategic regulators who are thinking now around these challenges of climate resilient sanitation and their role in enabling that. Next. And I know I'm coming up to time, but to close, I want to give two examples of what this roadmap looks like implemented in its totality. And we give these in-depth case studies in the document. First of all, a country at an earlier stage in advancing regulation, Tanzania, but where there has been really meaningful progress led by the regulator Iwura. And you see there the activities that have been taken across the core 4 areas of the roadmap. Next. We also need to recognize, of course, that no country will be implementing this roadmap in isolation from its socioeconomic and political reality. And the level of political commitment, the level of financial resource allocation to sanitation are enormously significant variables that will influence the pace and the level of change that is possible. And we aim to include some tangible examples of enablers in this area as put forward by respondents. Next. And then we close with the example of Portugal, where those enablers have been in place and they have facilitated Portugal in making progress really over a 30-year period, led by the regulator ESARO. And you see here the activities that they've taken across the roadmap, and now on the 4th iteration of their regulatory model, where they're focused very much on climate resilience. So again, quite a pure expression of what this roadmap is speaking to. Okay, back to you, Dave.
Thanks so much, Sam, for that roadmap to the roadmap. Many colleagues have been asking for the slides, and we will be sharing them, so they'll have your excellent presentation as well as the others. And of course, it provides a good introduction to the document itself. So after this concise summary and great overview from Sam, we'll now move into our country presentations. We have them from our partners and friends in Zambia, Malaysia, and Chile. So first, we'll turn to Peter Mutali. Peter is the Director and Chief Inspector at Zambia's National Water Supply and Sanitation Council, well known by everybody as NAWASCO. Peter has 24 years in the sector, and he has helped to shape water and sanitation policies across Africa. He is also a member of the WHO UNICEF Strategic Advisory Group and the RegNet Global Network of Regulators. Peter, we welcome you and look forward to hearing your presentation. Over to you.
So, Debbie, thank you very much for that. Yeah, so the presentation I have is on turning the sanitation roadmap into action. So, good morning, good afternoon, good evening. I'll not show you my face so that I just improve on the quality of the connectivity. So once again, let me say that I am honored to speak today, not as somebody introducing a new journey, but as someone reflecting on a maturing one. Zambia experience has helped shape the roadmap being launched today. In these few minutes, I would like to show how regulatory journey echoes the roadmap's logic and offer a real-world example of what it looks like in action. Next slide. So looking at the starting point, first of all, you need to do a situational analysis. And in the case of Zambia, let me state that Zambia's sanitation sector once lacked coordination. Many institutions were involved, but mandates were fragmented, and on-site sanitation had no clear regulatory home. As the sector regulator, NAWASCO, we recognize that better public health outcomes require clear accountability and structured oversight. This wasn't a theory, It was an operational challenge affecting real people. Our goal as UNESCO and as a country was to move from scattered responsibilities to coherent governance with a focus on fecal sludge management and on-site sanitation systems. Next slide. So as a country, we had to go through a process. And I think the first step that we looked at was the issue of legal review. So this was a turning point because we had to do a comprehensive legal review, which was supported by GIZ. We mapped out laws, policies, and mandates, and identified overlaps, gaps, and inconsistencies that were in our legal framework. This wasn't just about compliance. It clarified who should do what, where, and how. We didn't yet have this roadmap document, I should mention, but the process mirrors in it, establishing a clear legal and institutional foundation or framework. This review for us as NWASCO, as a regulator, remains one of the single most impactful regulatory actions that we have undertaken. Next step. The next slide, looking at translating the roadmap institutional reforms. Let me start by saying that what followed strongly aligns with what the roadmap outlines, particularly if you look at step 2 and step 3, you see that actually this roadmap speaks to what I'm talking about. We led the coordination of a new institutional and regulatory framework for on-site sanitation and fecal sludge management, which I spearheaded from this institution and also at country level. Rather than create something entirely new, we defined how existing institutions could fit together more effectively. Even with overlaps and laws inconsistencies, we ensured that they still fitted more effectively. We developed regulatory tools and systems, standards, guidelines, licensing regimes or systems, and also developed oversight mechanisms for both service provision and also regulation. We created the structure and the clarity that helped us to professionalize service delivery of on-site sanitation, especially. The next slide. So now looking at the early implementation actions, what we did as a regulator is that we had to focus on 3 important things in our early implementation phase or phases. The first thing that we focused on was stakeholder engagement, ensuring that there is complete buy-in across ministries, service providers, and other key stakeholders. In fact, if you come to Zambia, you hear the word JIT. If you hear the word JIT, know that we're talking about joint implementation teams, which consist of almost all key stakeholders, so that we work together in implementing the frameworks that we have clarified. We also focused on defining roles, who regulates, who provides, and who supports. I think that this was very important for us. The third one that we focused on is piloting oversight tools and systems, setting up frameworks for monitoring and also licensing. Those 3 things, we did them in our implementation actions in the early stages. So these steps reflect what the roadmap calls practical entry points. Our experience shows that even mature regulators must go back to the basics to cover sanitation adequately. Next slide. So we have learned quite a lot of lessons from the roadmap actually, and also what we have done. So Zambia's journey, let me start by saying that isn't perfect, but there are quite a number of lessons, clear lessons that we have learned. Even in mature regulatory environments, legal clarity must come first. sanitation regulation is different. It shouldn't be just an extension of water regulation. It requires tools that are tailored, systems that are tailored. But most importantly, if you want to embark on issues of sanitation regulation and service provision, especially on-site sanitation, leadership becomes of paramount importance. Regulators must drive the coordination, like what we have done as NWASCO, not to wait for others to coordinate the process. And finally, while we did not set out with this roadmap document in place or in hand, I can confidently say it describes the path we have taken. It actually captures what works. Last slide, looking ahead. Let me say that we still have work ahead. You know, sanitation is a multifaceted thing, and also so many things change along the way. So we still have work ahead. We are finalizing and also enforcing some standards, guidelines, there's tools and systems that we have developed. We are, of course, scaling up issues of licensing and also compliance to what we have developed. We have also tried to embed sanitation in our monitoring systems. More is being done, but it's a part of our inspections. But also, we are looking outward, sharing what we have learned, contributing to ESAWAS dialogues, and supporting peer regulators across the continent. I think we have a number of countries that have come to share with us what they have done. We have also shared with them what we have done. So at this point in time, let me say thank you, and I look forward to the discussion, and also to hear from our colleagues from Malaysia and Chile. Thank you very much.
Tremendous thanks to you, Peter, for that very satisfying overview of Zambia's journey. And as you mentioned, through ESAWAS, the sharing of the experience with colleagues throughout the region, it's really wonderful. And we will be sharing the presentations, colleagues, following the webinar, so you'll be able to look at them again. But now we're happy to move on to Maud Rosalie bin Mayudin. Rosalie is the director in the Licensing and Tariff Division at Malaysia's National Water Services Commission, which has the acronym SPAN. With over 13 years of professional experience with SPAN, Rosalie plays a key role in spearheading regulatory innovations and enforcement mechanisms within Malaysia's water and sewerage sector. He has contributed to the development of technical standards, such as on-site wastewater treatment systems and sewerage guidelines, and he frequently represents SPAN at regional conferences and expert discussions. And we're very honored to have him talk today about how Malaysia has been working to advance sustainable sewerage management in the country. Rosalie, over to you and welcome.
Thank you, Dave. Hi, everyone. Thank you for having me here. And it's a great honor to be here today to share with you the journey of sewerage management in Malaysia. So I'm Rosalie, representing National Water Services Commission, or better known as SPAN, a regulatory body for water supply and sewerage system in Malaysia, across Peninsular Malaysia and Federal Territory of Labuan. Okay, next slide, please. Next slide. So before we go into the details, let me share with you the milestone of sewerage management in Malaysia. As you can see in the slide, Malaysia gained its independence on 1957. But before independence, Malaysia's sanitation management was managed by the local sanitary boards. During that time, local sanitary boards were established to manage public health and sanitation in towns and cities area in Malaysia. But after independence, urban area was managed by the local authorities and rural areas managed by the Ministry of Health. During that time, septic tank was commonly used in Malaysia. Unfortunately, the lack of proper maintenance led to serious pollution in our rivers and affect our environment. So in 1993, the federal government initiated the National Sewerage Scheme, recognizing the need for centralized approach to improve sanitation and protect the environment. The new Sewerage Services Act was gazetted in 1993 and the creation of a new regulatory body on the federal level, which is Sewerage Services Department. And in 1994, there's a new concessionaire come in, Indah Water Consortium, or IWK, was established and became a national operator, and their task is to manage the and standardize sewerage services across the country during that time. So after a few years, in 2006, Malaysia undergo what we call water sector reform, which main objective is to have uniformly regulated water services industry in Malaysia. So the Parliament has passed two new laws, which is the first, Suruhanjaya Perkhidmatan Air Negara Act 2006, the law that established SPAN as a regulator, and the second law are the National Water Services Water Services Industry Act 2006, or we call it WSUP. So the WSUP is provide a legal framework to regulate the water and sewage industry in Malaysia, and this WSUP has come into effect on the 1st January 2008. And SPANs regulate both water supply and sewage industry in Peninsular Malaysia and Labuan, and under using our licensing regime. And IWK, as an operator, operates as our service licensee, which their task is to operate and maintain public sewage system in Peninsular Malaysia and Labuan. So next slide, please. Okay. Malaysia Sewerage Services are governed through a centralized yet collaborative framework involving multiple agencies at the federal levels. As you can see here, we have a Ministry of Energy Transition and Water Transformation, or we call it PETRA, who are responsible for setting national policies and strategies related to water and sewerage services. There are two agencies under PETRA. One of it is Sewerage Services Department. Prior to 2008, they are the regulators, but after establishment of SPAN in 2008, SPAN has become a regulator, and JPP, or Sewerage Services Department, continue their roles as a project implementer under federal government fund. Then we have SPAN as a regulator. And lastly, we have another entity, which is Indah Water, as I said before, is our national sewerage operator. IWK actually is owned by the Ministry of Finance Incorporated. And finally, we have the third ministry here. We have Ministry of Natural Resources and Environment. The two entities involved in the sanitation management, which the first one is the Federal Land Commissioner, who owned all the sewerage land reserve in Malaysia. And last but not least is our environmental regulator, which is Department of Environment, who regulate the effluent quality compliance from the wastes, so from the sewage treatment plant in Malaysia. Next slide, please. So the next slide, I will show to you who and how we regulate the sewage industry. As you can see in the slide, SPANs regulate both water supply and sewage services. First, we have our public and private operators. We regulate them through our license. For owner and operator of public sewage system, they need to have an individual license from us. And for private sewage system, they need to have a class license from us. So for example, Indah Water, as a national sewage company, they are currently obtained an individual license, a service license category, to operate and maintain public sewage system in Peninsula of Malaysia and Labuan. As our licensee, owner and operator need to comply with the license conditions stated in the license regulation under the Act. And one of it, we talk about KPI compliance and integrity and anti-bribery framework. So next, we have contractors and plumbers. So in order for any contractors to construct any part of water supply and sewage system in Malaysia, contractors and plumbers need to obtain a permit, a valid permit from SPAN, including private sewage dislodging contractor. As a permit holder, they need to follow a permit condition set in the law and the guidelines that we have for them. So the third one will be a consultant. We also registered a qualified person, which is a professional consultant that are responsible for handing over any public sewage system from the developer, construct by developer, to Indah Water as our licensee for operation and maintenance. And lastly, we have product and system suppliers, which we regulate. So any suppliers who want to supply their product for water supply and sewage system in Malaysia, they need to register with SPAN, and to ensure that the product, the system must be standard system recognized by SPAN. Next slide, please. So let me share with you our sewerage landscape in Peninsular Malaysia and Labuan. So Indah Water is our national sewerage operator, currently serve 5.2 million accounts. Domestic premises in Malaysia just pay around 12 ringgit or around less than $3, if I'm not mistaken, per month for the connected charges. And we consider as an affordable rate for the vital public service in Malaysia. Across the country, Indah Water manage around 7,794 public sewage treatment plants, alongside with 5,000 private plant operate by the owner. So supporting this public system is an extensive network of 22,000 kilometers of sewer pipelines, and we also have 1,542 network pumping stations. In addition, we still have 1.37 million septic tanks around, and 1.1 premises using a traditional facility, which is a non-standard septic tank, and which is continue to be managed carefully in Malaysia. But thanks to the effective operation by Indah Water have achieved an impressive 98% compliance rate in treated effluent quality set by the Department of Environment in Malaysia. So if you need a more detailed information, I encourage you to visit our official website at span.gov.my, and you can download the Water and Sewerage Factbook 2024 if you want to know more about Malaysia, statistic about sewerage and also water supply in Malaysia. So next slide, please. So we talk about sewerage sector funding. For capital financing, previously we have three main funders, namely we have federal government, Indah Water as concessionaire, and private developer. But now after federal government take over Indah Water in year 2000, Indah Water now focusing only on operation and maintenance of public sewerage system. Currently, the construction of sewerage infrastructure is mostly financed by the private developer. It is a part of land and property development. So private developers are mandated to construct and hand over these public facilities to Indah Water for operation and maintenance upon the completion. Then this arrangement is driven by a policy requiring the developer to install sewerage system for their developments, and has led to the private sector building the majority of the sewage treatment infrastructure in our country. So the federal government also play roles in capital financing. They also provide funds for the development of sewage infrastructure, especially for the construction of regional treatment plants through the 5 years national plan, and now improvement of the public sewage infrastructure supported by financing using sewage capital contribution. For operational expenditure or OPEX, IWK OPEX is primarily funded by the tariff collection from various categories of customer, and IWK also relies on dislodging fees and other services charges for their OPEX. Next slide, please. So I just touch a little bit of services that we have in Malaysia. First, we have the connected services. So connected services in Malaysia is where sewage from the premise directly pipe into the sewage, go into the sewage treatment plant. So this system is most common in Malaysia, serving the majority of premises that we have in the urban area. As you can see, span regulatory jurisdiction started from the premises until the point of discharge from the sewage treatment plant. Span DOE also regulate these sanitation services, but through the effluent compliance, where they set a standard for IWK to comply. So for maintenance responsibility, premise owner responsible for any system inside their compound, and Indah Water responsibility start from the connection pipe up until the point of discharge. So next slide. So the next service, that we have is the dislodging services. So under our act, it is a responsibility of service licensee, which is Indah Water, to dislodge the septic tank within their operational area. So under this new dislodging regulation enforced in 2021, a service licensee should do a scheduled dislodging of septic tank in their operational area. Under this new regulation also, septic tank owner need to empty their septic tank once every 2 years if the area is situated within the local authority area, and once every 3 years if their area is located outside the local authority area. We also have a private dislodging contractor, which is our permit e-holder, to do a demand dislodging activity in Malaysia. So next slide. At the beginning of the sewage management in Malaysia, we only focus on three main pillars, which is for the sanitation need, which is to address public health, then to address water pollution, and lastly, environment. Right now, sewage management in Malaysia has started to focus on the use of advanced technology and circular economy to ensure the sustainability of sewage management in Malaysia. We can see the use of new technology for the construction of regional treatment plant in Malaysia. We have two, which is one in Pantai, Kuala Lumpur, and Langat in Selangor. It is a state-of-the-art technology where the effluent produced is quality that can be reused, and the plant is built either below or above ground. And the top of the treatment plant facility, there's a facility that can be used by the surrounding population, surrounding areas such as Eco Park, multi-purpose hall, and sports field. So you can see this has changed the people view on sewage management in Malaysia when you start using technology from other countries like Japan and China. So on top of that, Water also has implemented initiatives such as reuse of treated effluent and treated sludge and producing a product that can be reused. Water also has used solar energy as an alternative energy source to save operating costs. Now, with the growth of developments such as data center in Malaysia, Water has also collaborated with industry players to supply reclaimed water for industrial use. As a regulatory body, SPAN support this initiative towards sustainability on the country sewage services industry. So, in summary, I can see that Malaysia's sewage governance is a collaborative system involving policymakers, regulators, operators, and environmental bodies. Each play a crucial role in ensuring our communities have access to safe, efficient, and sustainable sewage services in our country. That's all. Thank you.
Thank you so much, Rosalie, for that really excellent presentation and the comprehensive ecosystem that you have within Malaysia. Encourage the colleagues to visit the website for more information. We are a little bit behind schedule, friends who are on the webinar, so if it's okay with you, if you can stick around for a few minutes after the top of the hour, then you'll be able to hear everything that we have left in the presentation today. But now we would like to go on to our third and final speaker, who is Rodrigo Farias. Rodrigo is the Executive Secretary of Chile's 2030 Water and Sanitation Agenda at the national regulator SIS. With 20 years of experience in economic regulation, he holds a master's in public service regulation and is completing a PhD in engineering and technology. Rodrigo, we look forward to hearing from you about Chile's experiences. Over to you.
Thanks a lot for the invitation to this webinar. And well, I'm going to share the mature regulatory framework and quality focus, the experience from the superintendents of water and sanitation sector of Chile. Next, please. Well, the Chilean water and sanitation sector has been recognized as a case of study in the literature because of this picture taken from the United States government that indicates where you can drink tap water. You can see in Latin America, just in Chile, in Costa Rica, you can drink tap water. But unlike Costa Rica, in Chile, we have also 100% of wastewater treatment coverage and also sanitation coverage of 100%. Next, please. The figures from the last year, we have also, apart from the groundwater and surface water, we have 1.5% of seawater in intakes. And you can see the coverage, drinking water, sewerage, and wastewater treatment coverage are near of 100%. Indeed, the wastewater treatment coverage over the collected wastewater is 100%. Next, please. And the standards of quality of service, you can see that drinking water quality, continuity, pressure, sewerage service continuity, wastewater treatment quality, blink accuracy, and customer complaint resolution. All of these indicators of quality of service are near of 100% in Chile right now. Next, please. And about the coverages, you can see in this graph, the yellow line is the percentage of private operators the blue line is the drinking water coverage, the red sewerage coverage, and the green is the wastewater treatment coverage. So you can see that with public investment, Chile achieved like over 90% of drinking water and sewerage coverage. But we had a big gap about the wastewater treatment coverage that we achieved 100% by incorporating private investment. Next, please. So it was very important to apply the public investment before the liberalization. After that, we had a first reform wave where that was very important to take advantage of scale economies because there were stated 1 national and 11 regional dictatorates. And after that, in a second wave of reforms, it was the liberalization to incorporate private investment to the sector because Chile was signing a lot of trade agreements. So, and in that moment, in 1999, we have just 8% of wastewater treatment coverage. That's why we need to advance in that line. So in that second wave of reforms, it was stated a new type of regulation, the model film regulation that was created in Chile. Is a very case study in economic regulation literature. And in that regulation, the price includes all of the cost recovery, OPEX, CAPEX, and also self-financing and profitability for the operator. It also has a change of assumption article, the 12th article, that has been very important to incorporate the climate change. Because, for example, when there's no, because of the climate change, now there's no groundwater, so you need to build like a desalination plant. So this article is very useful to incorporate those changes to the model. And also in 1990 was created the Superintendency of Water and Sanitation Services, SIS, and that is aligned with the roadmap step 2 of the document. And the regulator can take in charge of the price, service quality, licensing, users' perception, surveillance, public benchmarking, etc. That is aligned with the roadmap step 3 of the roadmap. So you can see the coverages were in 2012, 100% for wastewater treatment. So in a very short period, it was a very sharp increase in wastewater treatment. In private operators, you can see that in 1998 was 2.7, but in the next year, over 50%. And in 2000, it was over 70%. And in 2006 is the percentage of private operators is similar as we have now. Next, please. So why a new strategic plan for the water and sanitation sector in Chile? Because the initial challenges that were the motivation to liberalize the water and sanitation Chilean sector had been complied because of these developed countries' coverages and service quality standards. So in 2017, the context was the worst drought in the history of Chile, the scarcity, water stress, the climate change, and also empowered users with a lot of information access, and also because of the technological advance. So in that moment, we ask ourselves, what are the new challenges for water and sanitation Chilean sector? So the regulator started a participative process in 3 stages. First, to identify the new challenges to 2030. The second stage, the elaboration of a roadmap for those new challenges. And the third stage, the elaboration of the work plans for 6 projects to 2030. Next, please. And this was a participative nationwide process with more of 700 people related to water and sanitation sector who were representatives of public sector, private sector, academia, and citizenship. We made more than 60 workshops throughout the country, interviews to more than 30 experts and relevant stakeholders of the sector, activities in 15 cities throughout the country, from Arica. Arica is near Peru, in the northern of the desert of Atacama, to South America, to Punta Arenas. That Punta Arenas is the southern city in Chile that is very near to the Antarctica. So what was the result? We found 8 new challenges grouped in 3 strategic axes, and CIS elaborated 12 projects to address those new challenges. So those 12 projects are named Water and Sanitation Sector Agenda to 2030. And that is the medium long-term strategic plan of CIS. And they review, iterate, and adapt to emerging challenges that is aligned with the roadmap step 6 of the document, and anchored in climate change, urban growth, and user-centric principles. Next, please. This is the Water and Sanitation Sector Agenda to 2030. We have the challenges, eight, and they are grouped in 3 strategic axes: climate change and efficient use of water resources, city and territory, and 21st century citizens. And for every challenge, the regulator created a project to address those challenges to 2030. Next, please. And the last one, what is the relation with the roadmap for advancing sanitation regulation that I named the document? So 3 projects of the agenda of CIS. First project is CIS Project 1, Risk Plans, because it addresses resilience-oriented investment and disaster preparedness that is aligned with the roadmap step 6. The CIS Project 4, Sustainable Sewage and Stormwater Management, integrated with territorial planning that is aligned with the roadmap steps 3.1 and 6. And CIS Project 10, Quality Standards in Rural Services, because the new law that we have in Chile extends the regulation to rural areas that are aligned with the roadmap steps 1.1, 3.1, and 3.4. And for final remarks, Chile's regulatory model demonstrates that the quality and coverage can be achieved through long-term independent regulation and strategic use of tariffs. Regulator, in this case, is not just a supervisor, but a strategic driver, planner, and innovator, leading adaptation in response to climate threats, avoiding the 0 day that we have another country that had that problem, for example, South Africa or Uruguay. And this because you cannot build the infrastructure in 1 or 2 or 3 years, because it took a lot of time. And the next, please. And the final remark, that these efforts position regulation as a cornerstone of climate resilient and inclusive sanitation systems. The next one, and thanks a lot for your attention.
Thanks very much, Rodrigo. Fantastic presentation, and we'll share the presentation so colleagues can follow up also through your email address there. Thank you, everybody, for these really wonderful country presentations from Zambia, Malaysia, and Chile. We did plan for a few minutes of question and answers to be moderated by Sam Drabble. We do have a number of questions in the chat box and in the Q&A session. What we're going to do, colleagues, is we're going to respond to those offline and put them in a document and share with everybody, together with the slides and the video, so that there will be responses to these really, really wonderful questions. But Sam, I thought we would just throw it over to you to see if there might be 1 or 2 questions, either which you had thought to ask a couple of our country colleagues, or if you wanted to take 1 or 2 from the chat. Probably keep it to a couple of questions, but promising that we will get back to everybody with fuller responses. Over to you, Sam.
Okay, thank you. And again, yeah, thank you so much for the country level presentations. So let me pick out a couple of questions. I've been doing my best to make a note of questions that have come into the chat. Starting with there are a couple of questions that connect into institutional frameworks. And actually a really notable trend that is taking place currently in Eastern and Southern Africa. So I want to put this question to Peter, if that's okay, Peter, if you're on the call. There's a question around what is framed by the questioner as self-regulation, and if there is a role for utilities in self-regulation, and particularly in regulation of small-scale private service providers. So to my view, this question is really getting at an important trend that is happening now in Zambia, as well as other countries in the region, where utilities are creating service agreements with the small-scale private sector. So it'd be really interesting to hear from you your reflections on what might be framed as delegated regulation and the role of utilities, how NOWASCO is supporting utilities to engage with the private sector.
Yeah, so Sam, thank you very much, and also thank you for the one who asked the question. The time sometimes is too short to explain everything, but in the case of Zambia, what we did was that when we went through this reform, we came up with a service delivery model where we have agreed, and this is what has happened, that we have only licensed commercial utilities. We have about 11 commercial utilities across the country. And all these 11 commercial utilities now, we have given them guidelines in terms of how they engage the private sector. They go into different actually contracts, could be service, management, lease, contracts, and they sign those contracts. Once they sign those contracts, it means that now us as a regulator will not be the ones to regulate those private operators directly. Now the commercial utilities, they will regulate on behalf of us. So that's what we call delegated regulation. And this is what we have done. If you came to Zambia, Lusaka, and other places, this is the concept that is there. We license the commercial utilities. The commercial utilities also go into those agreements with those. We have put a number of tools and systems in place so that they don't engage any person. There should be a criteria for anyone to be engaged. And they need to get a consent just to say, okay, we want to engage this private operator. They have met the conditions. Can you give us consent? And we give the consent. And that's what has been happening. We cannot talk much maybe during this part, but that is what we call delegated regulations to the commercial utilities to engage other third parties. Thank you very much.
Great, thank you, Peter, and thank you, Beverly, for the question. And just to highlight that there is more on this point under Area 3 of the roadmap in the document. Yeah. If it's okay, Dave, I think I'll put two more questions, but inviting just short responses. So we did have a question. We thought it would be interesting to hear more from Rosalie and from Rodrigo on enablers for effective regulation. I'm going to combine this with a question that was for you, Rodrigo, on the impetus for the Sector Agenda 2030, whether that was top-down or bottom-up, and where did the spark come from, policymakers, practitioners, or citizens? So I wonder if we can combine that with this question around enablers in the Chile experience. Where would you say that spark has come from, and was it more bottom-up or top-down?
It was the process was bottom up, but the spark was from the superintendent. The main authority was the person who started the process, who stated we are going to do this because we need the new challenges and discover what we are going to do because the initial challenges were complied. And about the enablers and barriers, I think it's the key thing is a clear regulatory framework, and the same for all the country. And very important aspect is the science-based decisions, because in Chile, the law is very detailed. For example, the tariff studies to state the price, it is in a very high level of engineering, economic, and prestigious academics participate in those processes. So when you have numbers, when you have data, when you have information, when you have science, the agreements are very, very easier. So you can solve in a better way the problems. And And about barriers, I think a lack of autonomy, because the regulator has to be independent of the politician cycles, and also try to avoid the politician's intervention. And so I think the key is the science-based decisions.
Fantastic, thank you. Really clear message on evidence-based approach, which has been exhibited by SISS. Just to flag a couple of other questions, which I'm sure we will respond to in the follow-up around climate resilient sanitation safety plans in Chile. So we'll respond to that, I think, directly in correspondence, and also around the KPIs that SPAN have used in Malaysia. I'm sure that's something that we can share. Mindful of the time, so if I can ask just a closing question and broaden this out slightly. We've been focused in these presentations on really powerful country level examples. I think it's useful just to close this with some reflections around the regional and the global level. And I don't know if we still have Yvonne on the line, but if that's okay to put you on the spot, Yvonne, ESAWAS operating enormously impactfully at the regional level and now moving continent-wide in Africa. So it'd be great to hear from you, your perspective on the role of the international community now, including, of course, in this changed landscape with reduced development aid. What do you see as the role of the international community, and that can be both at the regional and the global level, in supporting countries to operationalize the guidance in this roadmap?
I'm sorry, Sam, I should have jumped in here. We're a big family here around sanitation and regulation. Yvonne's other family, her daughter needed to be picked up from school, so she has actually left us, but we will convey that question to her and put it in the final document.
Okay, so if can I put someone else on the spot potentially?
Sure.
If we have Kitka on the line, I think Kitka, you're also working at the regional level. Really useful to hear your reflections on what is needed from the international community to support countries with regulation.
Yes, indeed, Sam. I'm online and want to really thank everyone for their contributions. And I think, as you rightly stated, what we need as the international community is to bring about these exchanges through an avenue like this webinar, where we can share lessons and experiences. But more importantly, I see our role in that of strengthening national systems so that national governments can really take ownership of initiatives like this and put in domestic resources. We have had examples from Malaysia, how the private sector has been able to really bring about transformational changes. And I think if we diversify financing and the different modalities of bringing in this financing to the sector, it will also go a long way in leading to the achievement of these results. So whilst we might not have the resources to do directly ourselves, we can facilitate knowledge sharing and exchanges. We can showcase good practices and bring about the different sources of financing that can really go towards this sector. Thank you, and over to you.
That's great. Thank you so much, Kitka. And I think that's a great note to end this part of the discussion. So I'll hand back to you, Dave, to wrap this up.
Thanks so much, Sam, to you and to our colleagues for those really nice responses. We'll capture them and share them in the final document. And this is clearly an important topic. We have, even going late, still about 80% of our colleagues who joined the webinar at the beginning still online. So we're going to take you out in about 3 minutes with just a couple of final slides. To do that, we're going to say that thank you for the time that you've spent with us today. The roadmap itself has been a journey. It began with a blog, a shared vision back in 2022, and has grown through a collaboration and many country experiences. The iconography that you see on the left, it reinforces a central message: regulation matters across the entire sanitation service chain. We saw this in one of the questions and comments. in the chat box today. In recent years, many partners have come together with complementary tools that align with the roadmap. These include the new Steps to Achieve Universal Access to Safely Managed Sanitation publication, which you see online there, and hopefully the link will also be in the chat. You know, you don't have to read all of these names here, but just wanted to say that we're really appreciative of the many individuals and institutions who contributed their time and expertise, case studies, peer review insights to shape the roadmap. They're acknowledged in the report. Special thanks go to the members of the WHO-hosted RegNet, the International Network of Drinking Water and Sanitation Regulators, as well as, of course, to the Gates Foundation and the Director General for International Cooperation of the Kingdom of the Netherlands, DGIS, for their generous financial support. Really also want to extend appreciation to our colleague Batsy Majuru at WHO for leading the development, coordination, and management of the roadmap, together with our colleagues Kate Medlicott, who is the sanitation team lead, and Sophie Boisson. Huge thanks, as you've seen tonight, to Sam Drabble for drafting the text and integrating the insights from partners into this really fabulous document that we have. So I just will go through quickly what might be some next steps. Well, certainly all of us can try to use the roadmap in various ways to strengthen regulation. Share your case studies and lessons learned on different platforms. Advocate for better regulation in your institution or in your country. Join peer learning platforms like RegNet. Collaborate on tools, training, and policies. There's already excellent training on WSS taking place in East Africa next month, we understand. And link efforts to SDG 6.2 climate and health goals, like we very much saw in Rodrigo's presentation from SISS. You can, of course, download the roadmap and share it with your colleagues. And another opportunity for future engagement is to join the webinar for the Global Call to Action on Strengthening Water and Sanitation Regulatory Systems. This will be launched on the 24th of June. 2 webinars are planned that day, one in English and French, and another in English and Spanish and Portuguese. This call, as you can see from the middle column, it's finished, but it'll be launched on the 24th. It'll be available in 6 languages. 43 organizations have come together to develop the text. It's really a shared advocacy tool that reinforces and supports all of our efforts to improve water and sanitation regulation. WHO and the International Water Association have been coordinating the initiative on behalf of the partners. So we hope you'll join us for that webinar as well. So with that, we would like to say huge thanks to all of our presenters from the organizations behind the roadmap. Huge thanks to our country colleagues for their very insightful overviews of sanitation regulatory activities in their countries, Zambia, Malaysia, and Chile. And most importantly, thanks to all of you for joining us for this webinar and on the journey for the roadmap to advance sanitation regulation. We wish you, wherever you are in the world, a continued good morning, good afternoon, and good evening, and we look forward to being in touch. Thanks very much.